All right, welcome. We're so excited about today's event. It's the CNO Leadership Roundtable. We've got some great guests to help us. I know all of us throughout the nation are struggling in some form or fashion. If you're in healthcare, if you're in the hospital environment, a lot of challenges that are going on right now. So we want to hopefully offer some help, some assistance here with our great leadership panel that we have here today. So I'm going to go ahead and announce them and go from the top to the left to right, and then at the bottom. So let's start off with Ms. Patti Gilliano. She is the System CNO for CHI in the Southern market here in Texas. Welcome to the show, Ms. Patti. How are you?
Thank you. It's great to be here. Excited to share some trials and tribulations and see what else is going on in the world with everybody. But great to be here.
And I didn't say the full name, and I apologize. It's Gilliano-McClung, so sorry about that.
Oh,
All right.
no worries.
And then we also have
Sometimes people call me Patty G.
Okay.
Patti G.
And we also have Dr. Derek Curtis. He's a CNO with the Harris Health System at the LBGA Hospital, and we appreciate you being on the show as well.
Oh, thank you very much. I'm very humbled for the invite and look forward with sharing some knowledge.
Absolutely appreciate that. And then we also have LaTivia Carr. Hopefully I said that right. LaTivia Carr. She is also a chief nursing officer located at the Riverside Healthcare. So we appreciate it. Thanks for being here today.
Absolutely. Thank you for having me, and glad to join the panel with such esteemed colleagues, and looking forward to information sharing and also learning and hearing about some other practices across the nation. So thanks for having me.
Absolutely. No, we appreciate it. Appreciate you guys being here. And Joanne, if you can, let me know if our sound and our picture is all good. We love to hear that as well. And those of you who are just chiming in, let us know what city, what state, what country that you're chiming in from. Feel free and pour in with your comments, your questions, your feedback throughout the discussion. So let's talk first about challenges and perhaps anything that you've started to do or address some of the challenges that we face. Let's address what some of those challenges are first, and we can go in a round table starting from Patti, and then we'll go to Derek, and then LaTivia. How about that?
Sounds good.
Hey, sounds good. So yeah, challenges I'm learning from colleagues across the country. It's really not specific to any one area, but here in Houston, we've recently had an uptick, a surge of our COVID patients, and it's really put some compression on the entire market, and probably beyond. I mean, I know it actually is beyond, but staffing has always been a bit of a challenge. And a lot of what we're facing are things that relate to specifically getting staff committed to be a part of our family and our team. And we were chatting just before, we're very happy and helpful to have the ability to have some assistance from our state nurses that have come in and some local agencies. But, keeping the consistency and quality is really important to us. And so the challenge of balancing enough staff, but also engaged staff that can provide really good quality nursing care has been a real challenge. On the flip side, the challenge of providing really good care to patients as they're going through the different experiences with COVID, we've actually been able to offer some monoclonal antibodies. And I think that's exciting because it poses a different challenge and getting that all up and running. And reminder now, we just did this a year ago. It was kind of like staff just said, wait a minute, we got to do this again. And so reinvigorating people on top of staffing challenges, on top of new sickness, it's really been just a unique time and really tough from so many vantage points. So it's not just one thing. And I think that's what I think I wanted to bring to share and discuss from my vantage point today is it's just coming at us from several different facets.
Absolutely. And how about you, Dr. Curtis? What's been kind of some of the challenges you've been seeing on your end?
Yes, thank you. And so very similar challenges, but really with the surge, this time happened so fast and so quickly. We hit higher peaks with the number of COVID positive patients in the hospital. So it really challenged our capacity. And so we had to expand our ICU capacity above our normal. We had to expand our med surge and IMU capacity as well. And so that also, the secondary effect of that was it really challenged the staff, and staff are, they're tired and they were trying to recover from the first 3 rounds of COVID and the surge that occurred last year going into and coming into 2021. And as we try to, provide leave, respite for the staff, another surge in the Delta variant happened. And this time it happened a lot faster. I remember last year, we started out with 20 COVID positive patients in the hospital, and that quickly, it didn't jump as fast. By August, September timeframe, we were about 85 COVID positives in the hospital. This time it was June, towards June, end of July. We started with 20, and quickly within 2-3 weeks, we're at 80, and we hit a peak of 109 COVID positive patients in the hospital. That in turn created, the more that you have in-house, as they're either going to turn within 10 to 14 days and get better and go home, or they're going to end up in your ICU. And so we had several that went to the ICU, and that just, we're on a platform of 24 ICU beds, and currently we expanded to 42. The other part is, when you look at COVID and the isolation of the patients, patient satisfaction became a challenge. And so we had to learn some things around dealing with that challenge and making sure we stay connected with the patient, the family stays connected with their loved ones, and that our staff really make that connection with both the patient and the families. And then, as you said, staffing is huge with the number of contract nurses, the competition with hiring contract nurses, and the salary and the rates. Trying to maintain your staff in-house, but also maintaining their salaries, and they're looking at what the agencies are making. And so you have that battle of some staff decide that they want to leave the organization and take contracts. So that was huge for us. And that created a huge challenge with maintain it. Even though we expanded the beds, how do we staff the beds? And so huge challenge for us. And I'm thankful for the state resources that were made available, the crisis nurses. We have contracts with Crucial Staffing and Angel Staffing, and that's given us a lot of relief and able to manage the patients that we have.
Oh, very good. Okay, and then LaTivia, how about you?
Certainly, I can echo some of the same sentiments shared by both Patricia and Derek in relationship to the staffing challenges. So I'll just start there. And I think Derek touched on it a little bit with the struggle with compression. And so as we seek to shore up our gaps in staffing and bring in external resources, it is managing that message and communication to those staff who are on site and who are our staff, to help them understand the rationale behind bringing in additional resources and, managing, well, I'm not making that much money. If you paid me that, et cetera, that I would work more hours. And certainly we have seen transitions from our staff taking jobs outside of the organization to make that higher wage, right? So those are some of the challenges that we are working through. We didn't have the challenge of bed shortages, et cetera, during the first surge, nor this surge, I think primarily due to location. However, the staffing crisis is something that certainly we are feeling, as many of our other healthcare organization colleagues are feeling across the country. Something that we're focused on here is our nurses' mental health and resilience. And I think someone else touched on, how do we keep our nurses encouraged? And as they have gone through the different swings of COVID, first with, the start of the pandemic back in March, and then that first huge surge that we experienced here in November, where I think at one point, while we had a large number of COVID patients, we also had a large number of our staff who were also sick with COVID. And so while we didn't run out of beds, we ran out of staff beds, if that makes sense, because we had upwards of, over 40 plus staff out at one time that were direct care caring for patients here in our hospital, unable to provide care for patients here in our hospital. And so that became a challenge. And so they went through that swing and now bring on the Delta variant, which is spreading fast and is unpredictable. And we've got people who are unvaccinated. So currently in this county, we are at an 8.3% positivity rate, where just maybe a week or two ago, we were at 5%. And I think maybe about a month or so ago, we were in the 3s and 4s and, thinking that we were ready to celebrate. And here we are sitting at 8.3% and inputting back our visitor restrictions, et cetera, again, which is going to increase some of that lift by our frontline caregivers as they manage both patient care and trying to juggle interactions with families and use the different modalities that we've implemented through video chatting. All of that takes the caregiver away from the bedside. So what we've tried to do is launch a series of nursing mental health modalities and resilience support through our Well in Mind services we created. We have a room of magic, which is our room that was donated by some philanthropists some years ago that we normally would show movies in for our pediatric patients. So we turned that into like a Zen room for our nurse staff. So we put massage chairs in there, and there's aromatherapy infusing, the lights are down low, and there's a mood music playing on the screen. So those are some of the things that we've done. We have nursing rounds with what we call coffee cart at night. So my night shift educator team and our magnet team, they round at night at least once a week, sometimes more than that, depending on what's going on in the house, with the coffee at night, because during the daytime, our day shift staff have access to the coffee shop. So it's a huge deal for the night shift to have access to coffee and hot chocolate. If I'd have known years ago that that's all I needed to provide was coffee and hot chocolate to the night shift to make them happy, we would have launched that years ago. But even with all of those things that we are trialing, I still bear the burden of, balancing. I think Derek spoke to making sure that we are metric focused and reaching our goals from a patient experience perspective. And I think Patricia spoke to some of the quality concerns that you have when you bring in external stakeholders to care for patients in your house, so to speak. So those are the things that I have at top of mind as we look at how we're going to make it through this transition. We do have the benefit of being connected to both a local university and local community college that is a nice theater source for us, but then that brings on the challenge of onboarding. So as we bring in all of those new grads, how are we going to ensure that they have a smooth transition to practice, knowing that they really won't be ready to fully care for a team for 18 months, if we're honest, right? They'll be able to take patients, but they won't be well acclimated from a perspective. If you look from a beginner to expert, novice to expert on that trajectory, they won't be really ready for 18 months to competently take care of patients in a way that we would expect, someone who would be at the advanced beginner or competent proficient level. So those are some of the challenges that we face.
Appreciate you sharing those. We have quite a few who have piped in with their comments, so we want to just kind of recognize them. So we have R.D. Yoder. He says, such great servant leadership. So that's for all of you. So thank you for being here. And then Leon Fress, he says, here supporting Patti from the CHI-CSH team. So that's for you, Patti. And then let's see, we've got also Farah has also liked our broadcast as well. And then we have some others. So thank all of you for being here. Please feel free to put in your comments. One thing that did stick with me out of what you said, LaTivia, sometimes those of us who aren't numbers people, to go from 3 to 4% to go to 8%, that's double. So everybody can understand that. It's not just 3 percentage points, it's double what you had before. Is that right?
Absolutely.
Yeah.
Absolutely.
So,
and one of the challenges is we are also the lowest vaccinated county, one of the lower vaccinated counties in the state as well.
And where are you located?
We are in Kankakee, Illinois.
Okay.
So that's in Kankakee County.
Just want to make sure everyone understands that. Now, some of the things that I've heard, and these are just things that's just kind of around, right? And I want you guys to either put it to bed or confirm it or whatever the case is. But I've heard, just talking to just lay people out in the community, oh, we hear there's lots of nurses and medical professionals who oppose the vaccine. So I wanted you to tell me, is that true? And if so, what is being done to kind of address some of those concerns? Maybe Patti, if you want to start with that, we can just kind of go around the table with that as well. How are you overcoming that?
Yeah, sure. We started vaccinating early, as soon as the vaccines were available, and I think we kind of started to just get ahead of the curve early on. So many of our staff were vaccinated back in the beginning, January, February. Since then we've provided a ton of education, and we've made opportunities available for staff to continually still, make that decision to become vaccinated. Of course, there's always, special circumstances. People may have a medical or religious reason that they choose not to vaccinate, but I think we've been super proactive with the education we provide. I think between physicians, our pharmacists, the leadership team, we've been available to answer questions and provide good literature and good documentation for the staff. So I think that's something that really helps to make a difference for staff to make an informed choice. And, we've really seen just a positive turnout, with the majority of our staff getting vaccinated early on. So I can't say that it was a predominant issue, but again, there's always going to be somebody who's an outlier, but most of our staff really have embraced the opportunity.
Wonderful. And then, Dr. Curtis, what's your take on it? What have you seen from your end?
Yeah, it's really about the communication and explaining the reason behind the vaccination. For us at Harris Health System, we're about 70% of all of our staff vaccinated. So we would like to be at 100%. Of course, unfortunately, we're sitting at the 70% rate. But again, the town hall meetings, explaining, we're having our IP physicians, infection prevention physicians that joined our town halls and explained the research behind the vaccine was very helpful. We shared stories of family members that weren't vaccinated, and some of the outcomes of that were shared by other employees, and that was a way to really get some staff to see, if I don't get vaccinated, here's what the outcome could be. And then a lot of staff, they see the outcome of the patients that we serve. And so those are things that really move our employees to get vaccinated. But again, it really is about the communication, and giving them the knowledge to make an informed consent was very helpful. So now with the president and the mandate, I think we'll see more hospitals go to a requirement to have the vaccine for employment. And so we'll see where that leads to in the future.
Very good. I appreciate that feedback. And how about you, LaTivia? What have you seen from your end?
From my end, I would echo what both Patricia and Derek have stated. It's all about communication. I will say that here at Riverside, we were very early adopters for the entire vaccination process. And as far as the county is concerned, we launched the vaccine clinic. So our organization pretty much launched the vaccine clinic for the region, and we were leaders in providing vaccines to both our staff. We made it available to our staff in frontline first, and many of our staff took advantage of this opportunity after living through what they saw occur in their communities and to the patients that they cared for. And so of all of the vaccinations given in the county, our organization gave over 33% of those vaccinations. And the frontline nursing staff were a part of those vaccine clinics. And so there will always be a remnant of individuals who will have reservations for whatever reasons as to why they will or will not get the vaccine. But by and large, we have seen a positive response from our clinical staff as it relates to becoming vaccinated. We continue to have conversations both in person. Our chief medical officer and our infection prevention physicians both have gone to departments and held meetings with individuals at the department level. We have one-on-one conversations if necessary. Certainly the our governor here in the state of Illinois put out a mandate just recently that we are managing before the president's mandate. And so we're working through all of those steps and what does that mean for our organization and for our staff. But by and large, we've seen a positive response from the caregivers. They understand the importance of being the example and making sure that we're safe as we're caring for others.
Yeah, absolutely.
We have a responsibility to not only care for others, but to make sure that the ANA Code of Ethics states that we are to take the same prescriptions that we give out. So to paraphrase, so to speak.
Yeah.
So living our mission as nurses and following the guidelines that we attest to is something that we take very seriously here.
Another thing that I want to take very seriously is our water break. So do you have some water here? We could take a little water break halfway through.
Water with vitamins.
And I have a question for y'all. Who would like to take my question first? This is a kind of a fun question. Who would like to take it first? By the way, Leon Fresh says with the
Fire away.
Okay, great, Patti. See, Patti knows. Leon Fresh says with the recent announcement from the president requiring organizations that receive federal dollars to require the vaccine, I'm curious, optimistic to see how this will impact the number of resignations from our system. So I do want y'all to address that too, along with my little question. Okay. All right. So Patti's going to take it. Would you rather? This is my would you rather. Oh, you want a would you rather or open ended? I'll give you a choice.
I don't know. I'll do open ended.
Okay, open ended. All right. What is the funniest or most bizarre experience you've ever had related to your work or your career? Does anything stand out for you?
Oh, wow. You know, I've really had a few. Let's see, which one's really a good one? It's like the things you just can't make up, right? I will tell you the most bizarre one that I had was when I was director of the operating room in a state in the far Northeast. We'll leave it that.
Okay.
Pretty much where I started my career. And I had just stepped out of the department because I was in peri-op, so I was running the OR. And we had 2 big open heart rooms. And next thing you know, I had staff come running out saying, oh my gosh, we have a flood, a pipe burst. And I said, what do you mean? What do you mean? And I went into the OR, and in the open heart room, there was just a waterfall pouring next to the patient in the OR. And, you know, it's a sterile procedure, the whole area, and you've got this water coming through, which I was fairly certain was not sterile. You had seconds to make a decision. And, you know, all I could think of was facilities don't know what to do. And I called facilities right away. Seconds, they were super responsive. And they brought this giant saran wrap sheet on a roll. And I've never seen people move so quick. And they took it across the room, secured it to the ceiling. Meanwhile, the surgeon continued to operate. The music continued to play. Everything went well. Patient was done. No untoward effect. And of course, we followed the patient for 6 months after, just to be sure. Patient was totally fine. But you couldn't like predict anything like that, and no one would ever believe it if you ever told them. So I mean, it was just really way out there. But
wow.
That was the craziest thing I've ever seen.
That deserves this right here. That's amazing, and it had a great outcome. So thank you for that. Okay.
Yeah.
So what are your thoughts on these mandates? Do you think that that's going to affect resignations from healthcare systems? Do you think that would put some of the healthcare organizations at risk?
You know, I think people have to really decide what it is they want to do. I'm not a fan of the word, much like I was never a fan of the word when I used to have to. I've worked in both union and non-union facilities, and it really bristles people with that word mandate. So it's a tough one. I think you have to use your own personal integrity, and I think it's going to be interesting to see what the fallout may be. I think we just don't know, but I think the numbers that I've seen come in of people that are vaccinated is really high. So I think it'll be a small percentage, but I do, you know, that word makes things just a little bit harder to swallow sometimes when we want to treat each other as professionals in the work world. That mandate really kind of cast a negative tone to things, and we all should be able to make, you know, appropriate choices. So that may be what is this tipping point for some people. Other than that, I've seen people very excited and responsive to be a part of the vaccine program. They've had choices to several different ones, but when you put that mandate, I think people wonder, well, what's next? What's going to be the mandate? And we have to be careful that we preserve people's given rights in this country. So I think people have been more than willing to support the vaccines. So I don't know, but I've seen a couple of things come up recently and just some news events about it. So I think it's going to put an even further added strain to an already challenging system of filling holes in staffing. So I just would hate to see that we couldn't be a little bit more collegial. But I've been doing this a long time, and I don't think that it's wrong to want to make things of this is what a requirement, but I think it does make it difficult for people. So hopefully people will, they'll see the light and they'll get educated.
One other follow-up before I get Derek's comment next. Maybe y'all can include this in your comments. Do you require any sorts of vaccinations? Like, do you require MMR or some of these other older vaccinations? Are those required, or are those also a choice of the person?
I mean, just to finish us off, we typically require all those childhood vaccinations unless you can show immunity through the blood testing. And, for those that, whether they do or they don't, many organizations still provide that. It's not mandated. You have the option for a religious or medical exemption if you, have documentation of such. So, it's still an option.
Okay. How about you, Derek? What have you seen on your end? What's your thoughts on this?
I think that we will have some employees that may elect not to stay with the organization because of the mandate. To use you could find another word or another synonym that would be a little bit more easier to take for employees is required versus mandate. But several staff, just like the flu vaccine is required for all employees, and flu season is coming. And so majority of our staff will take the flu vaccine. We have our children, and many of us have children that are school age, and the requirement for a vaccination before entering school, if our kid can't go to school, then we'll make sure that we take them to the clinic. We'll get them vaccinated. We'll stand there next to them, and we'll coach them through the shot, and they'll meet the requirements for school. So I have some mixed feelings about it. I think we need to make sure that one, we protect ourselves so that we can provide the care for our patients. And I think that's the most important thing. Is if I lose 50% of my employees due to the lack of being vaccinated, and I can't care for the patients in the hospital, I do have a concern with that. And so I do support having all staff become vaccinated. Again, the term mandate is not one that, and especially with our millennials, not liking to be told what to do. So prior to mandates, it's asking and it's informing and it's educating and it's communicating. It's starting with the why and explaining why, the reason. And a lot of times if you can explain the why and start with why, usually most people will be compliant. But when you're not compliant, at some point, the organization has to say, what's the greater risk? What's the outcome if we do not require that our employees become vaccinated? And so you have to weigh the risk versus the benefit. And I think more and more healthcare organizations are leaning towards a required vaccination.
Okay, I appreciate that. And did you want to take a stab at that question there? What's the most funny or bizarre experience? Or I can give you a would you rather.
I will tell you this one. It's we've had a water incident, like Patti said, but this was really bizarre. And I had a department, one of my departments, called Safe Harbor. Well, the nurse called Safe Harbor. She was very concerned that they were overstaffed and they were understaffed, and that it was a patient safety issue. So I immediately went to the department. I walked into the unit, and I asked the director. I was like, "Hey, where's the nurse that's filing Safe Harbor? What's the concern? Have we addressed it? Have we brought enough staff in?" And she said, "She's over here, and she's in this room, and she's very upset." So I'm thinking, okay, I'll open the door. I walk in, and she's having breakfast. She has no patients assigned. She was filing Safe Harbor based on the fact that she could potentially get patients, but at the same time, she was having breakfast. And so I was very taken back by that one.
Oh my goodness. Yeah, see, I was not expecting that. That's a pretty good one too.
And it's hard because you try to maintain your composure and your professionalism and address their concerns. And the sweat was coming down my head, and I was like, okay, reel it in and say this in a nice way. This is not an unsafe environment if you have time to eat breakfast.
Yeah. Okay, that was a good one. Okay, LaTivia, how about you? What are your thoughts on this requirement or mandate, however you want to put it, with the vaccinations, and also do you require other vaccinations?
Well, certainly, like most healthcare organizations and health organizations in general across industries, there's always requirements for hire, right? So you have to show that you don't have active tuberculosis, et cetera. And so there are requirements for hire prior to the entrance of COVID and now the COVID vaccine. As it relates to the vaccine and mandation, there's always going to be the chance that the mandate is going to exacerbate an already stressed healthcare system as it relates to turnover. There are people who are already leaving the profession prior to the mandate just from the sheer exhaustion and lack of stamina in dealing with the pandemic. And so this new what I will call moral injury in some respects for some individuals adds a level of complexity in an already complex system. So there is no easy answer. I don't know if Patricia or Derek throughout this process have come across making really good decisions based on lots of good information. I was in Vegas on Monday participating in a panel for discharge planning, and I called them the CDC 5-minute updates, because just as soon as you made a policy or a plan and sent it out to your organization and here's our direction, the CDC came out with a new rule. And so you had to reel that back in and start all over. And so what we're dealing with, even with the vaccine, is a very complex issue. And quite honestly, there are a lot of feelings around it, okay, right? And so I think that it is really important to recognize that it's a very charged topic, both for healthcare and within our communities. And for us in the healthcare sector, for me, I go back to my earlier comment of we have a responsibility to our patients and to keep them safe. And for me, it's, beneficence, what's going to be the greatest amount of good for the greatest amount of people. And that is for us to have a vaccinated direct care staff body. And so when we look at that, we know that there is an opportunity for there to be some separation. And certainly that's not what we want to see. Again, I go back to Derek's comment of, how do we engage our staff and provide the why? I do believe that we have a huge number of staff who understand the importance of being vaccinated and being able to provide a safe environment for our patients, because we're here to heal our patients. We don't want to make them sick or be the cause of an illness. So if they're not here with COVID, we certainly don't want them to get it from us.
Mm-hmm.
And so those are the things that are top of mind. And like I said, we're having those conversations on a regular basis, just keeping our staff encouraged and letting them know that, we're here to support them as we have been since the beginning of this. And we're all in this together, but we recognize that there are a lot of emotions and a lot of different feelings about it. And certainly, just like with the flu vaccine, there are opportunities for declination based on, if there are any medical issues or things that would bar you from being able to become vaccinated. And certainly strongly held beliefs and religious religious declinations are something that we're looking at. But again, we have to do what's best for the patient first and foremost.
That's all great feedback. And for those who are just joining us, if you are, we're just merely discussing how those possible mandates would affect the staff and perhaps resignations if they were implemented. We're certainly not making any judgments on whether it should be a mandate or not. But thank you very much for all of your feedback. That's been great. Now let's finish off with a kind of round robin on ways you've been able to overcome any of these challenges and successfully. Maybe it's a tip you want to share with others. Maybe it's a win you want to share. Anything you want to share. We'll just go kind of the same order. Patti, if you want to get us started, and then Derek, and then LaTivia.
Oh boy, let's see. I will say, if nothing, I feel very inspired that two things we've done that's just really been impactful for me as a nurse. And I tell staff this all the time and patients' families, and I feel very honored as a CNO because I do have the ability to kind of move around unit to unit. We have a visitation policy that has actually been supported by the state. There is a state bill that came out just recently, and it requires patients to be able to have a visitor unless another reason would preclude that, for safety reasons, of course. But it has really been such an opportunity to safely allow patients who may or may not make it home to have a visitor with them during this time, especially if they are COVID positive. And, we did that last year. We locked everything down, but I have to tell you, in my personal growth as a nurse over these last 30 some years, the ability to have a visitor has done so much to the part of healing. And I think that's where I'm super inspired by the whole, the corporate policy on human kindness, because we have to remember at the core of everything, it's that patient. And, rules and everything else are so equally important to the extent that they're going to protect and preserve patient care. But the ability to have that visitation has really been instrumental. And then the other piece, because we feel so helpless a lot of times, especially as the surge, the wave hit us, it took us nearly 5 weeks, but we got our monoclonal program off the ground. And I feel like at least we have a way to help versus what we were faced with last year. And so those two things are just super important. And I think I'm super inspired by it. Every day I see another patient or two coming in for the monoclonals. And the fact that I've been able to talk to patients and families who do have COVID patients, and they come in and they're able to see their loved one. We teach them how to gown and glove up. It's kind of a one in, one out. It's handled very well. I feel like we're giving that human kindness piece to the patients and families. And that's really what inspires me to be here. So I'm excited about that.
We're excited about that too, and so is our audience. We appreciate that. Love that. I love that you're putting that in place. Okay, how about you, Derek? What would you like to share with us, please?
For me, our entire team really has been about teamwork and bringing the entire team together to fight through a challenge. One, from a nursing side, again, going back to the basics of allowing frontline staff to make that connection with the patient. We've done a lot of things around bundled care, but really still connecting the family and the patient together has been huge for us this second time around with COVID and the surge. And then I say the teamwork is because it takes a joint effort when you have the speed of trust amongst all your staff and all of your leaders and your physician partners. You're able to make those adjustments a lot faster. And so as we saw the surge occur faster, when we collaborated, bringing in our frontline staff and listening to them and what were their lessons learned from the first round last year, and address those concerns ahead of time, we were able to be more prepared when it came to supplies and resources. When we brought in our physician partners to engage in what resources they needed as far as managing the patients and the type of physicians that we needed on board and the type of workspace that they needed when we wanted to expand, they were part of designing that area to make sure that we could safely care for those patients. We brought in our operators that we just said, hey, we need an isolation room and we need negative pressure. And we let them use their expertise to develop those areas for us. Supply chain, made orders in advance so that we wouldn't have the issue of N95 masks or gowns or linen. All those things were done in advance. Our pharmacy team, our biomed teams, with making sure we had the right equipment. With COVID, you need more monitoring, pulse oximetry monitoring, and they were able to come to the table and give advice on what resources we needed and how to maintain it. And then from a frontline staff, all meetings that we had, you cannot over communicate. Communication has been key with developing the trust amongst our staff. And so each week we would have a town hall that's led by the CEO, the COO, myself, and the chief of staff as a group, and present, being very transparent up front when we have a surge or we see the number of patients, whether, on a 230 bed platform, we have 100 COVID positive patients in-house, and where the resources are needed. When staff know that, they tend to be more flexible and willing to expand above their ratios because they know, and when we tell them there's no other resource in the community, then they're willing to, and they understand, and again, starting with the why, they respond and they give all they can, and they have given all they can during this pandemic. I will tell you that staff are tired, but as we communicate and as we work as a team and we become more and more resilient, we're able to achieve much more than we thought we could.
Wow, that number just hit me. I'm kind of a numbers person, and when you said 100 patients out of 230 beds, it just floored me. Wow.
Yes.
Have y'all ever seen one diagnosis or one disease take over that much of a hospital before?
That's amazing, and again, it's a challenge, and it's not just isolated to one hospital. It's the entire community, it's the entire state, it's the entire country that's fighting this battle. And so, we work through it, we learn, and we continue to move forward.
Well, we appreciate you, appreciate what you're doing, and I see quite a few from the audience, so they appreciate it as well. So we definitely want to show that appreciation for you guys. Okay, so LaTivia, what are your thoughts? Any positive you can finish out our hour with?
Absolutely. So I think that what inspires me most as the chief nursing officer is the fight that I see in my nurses and their passion every day for the work that they're doing. And I greet every new grad nurse as they're hired. I have a special greeting for them one-on-one with me individually. And so to see their passion, and I always ask the question, what brought them into nursing and why do they do what they do? And so after everybody shares their stories of, oh, my mom was sick or my mom was a nurse, or I always remind them to keep that in mind because they are entering the profession at one of the most challenging times in history that I can recall since the last pandemic. And so they will need to pull on that information. They will need to pull on their why when they get in those challenging times. And then I also let them know, because they come to my office, I also let them know that my door is always open. And so when they have those moments where they feel like they just need to talk or they need to see me, they can come directly to me. There are no barriers here. Nobody's stopping anybody at the front door when you come to the C-suite here. So that's one of the great things that I love about our organization. In terms of transparency, I think that We've learned to be very nimble and agile as an organization and be able to make decisions in a more efficient manner. And so that's something that's been a key takeaway from us that we learned from COVID that we've held on to, even as we've transitioned out of, true emergency response mode, but to really be more efficient with our time and decision making and make things happen for our organization to keep the business moving forward. Because at the end of the day, we still have a bottom line that we have to be mindful of. And so how do we look at our resources and look at our business model and make sure that we are making the best decisions to be able to sustain and provide care well into the future for our community once we come out of the pandemic. What also inspires me is that through all of this, the amount of collaboration and teamwork that I've seen across our system. So we have a fully integrated health system that includes a long-term care facility, independent and assisted living, as well as inpatient and outpatient rehab, all levels of mental health. To see all of those different entities come together, where you may have seen silos on a limited scale before, we're all working together in a very succinct fashion to ensure that we're all providing the best care for our patients. And then I will have to say, from a medical community perspective, to see like the panel that I'm participating in today, as a healthcare community, I've seen more collaboration from peers across not only the state but the nation, saying, hey, so what are you all doing that we can adopt, or how can I help you? We serve a large facility here in our community for developmental needs, and we were able to partner with them so that they would have a plan to cohort their patients on site so that they didn't overwhelm the two hospitals. And myself and the CNO from the hospital across the river were able to, collaborate together to work with that facility to say, hey, what do you need? How can we support you? And I think going into the future, that's something that we can't lose sight of. At the end of the day, we're all in this for the same reason, and that is to provide excellent care to our patients, no matter where they are in the country. And so how do we as a community continue to come together as healthcare leaders to ensure that we all have the best information to make the best choices to be able to do that?
Well, thank you for your time. Thank you all. This is from all of us. Thank you for what you do. We appreciate you. And I'm sure many in the medical community are doing this also to your effort. So appreciate all of you for being on today. We're going to go ahead and wrap it up, guys. We're at the end of the hour. Let us know in the comments what resonated with you. Perhaps you can tell us about your situation, things you enjoyed about today's program, and certainly thanking our guests. I want to thank all of you. Thank you, Patti, for being here once again. I appreciate you, Derek. Thank you.
Thank you.
And
appreciate it.
Yeah, and absolutely. And LaTivia, this is your first time with us. We really appreciate you being with us today. Let's go ahead and say bye to everyone. Thank you, everyone. Bye.
Thank you. And Rollis, for the next time, you can call me LT.
LT. Okay. I'll do that.
That's what everyone calls.
Okay, so Joanne's going to let me know
that.
we can cut it off. I like it. LT.
Okay.
Absolutely.
1 second here.
Thank you.
Thank you.